Mr. Tucker, I'm looking at you. Where did we leave off with
I believe you left off on delivery.
on delivery? And we were talking about numbers within packages.
That was the beginning of the conversation.
Yeah.
The package, it's not the number, it's the total THC milligram content
Right.
per package,
Right,
which is also separate from transaction and possession limits, concentrate caps, other limitations on just size of
I
package.
think what would be helpful to us is to hear from the chair of the cannabis board.
Absolutely.
It's always.
Senator Cummings, that she was gonna go from one.
She's going from one place to the next.
Oh, yeah.
We know where to get it.
We voted on something last night. I wasn't there, so.
I don't want to undermine the work that economic development has done. I think, our goal here is to just really understand the sort of the healthcare consequences that we looked at. Thank you.
No, thank you. So my name is James Pepper. I'm the chair of the Cannabis Control Board, and just to pick up where I left off yesterday, everything that is in this bill has been implemented safely and effectively in other states. So we're not breaking a lot of new ground with this, except we are breaking new ground in Vermont with many of these concepts. But I coordinate with my fellow regulators around the country, and these concepts have been implemented safely. Now, what the long-term public health outcomes are, we don't know, but we do know people have been using cannabis, Vermont pre-legalization at the highest usage rates, both amongst the adult and the youth population in the country. So that was pre-legalization, and we haven't, as far as I can tell from the monitoring the future surveys and the youth risk behavioral surveys, we have kind of plateaued on youth usage. We haven't seen an increase, but we started off with a very high number. So it was almost kind of full saturation prior to legalization.
Right. So we've just been starting to get it under some kind of regulatory environment.
That's right.
Yeah.
If you have any specific questions about this, the nature of my testimony in the Economic Development Committee was more along the lines of not whether you should or shouldn't do these things. It was more of what it would take in order to implement these things effectively. We did raise some concerns around delivery, mostly because, the point of sale is one of our most highly regulated pieces in our rules, in our focus of our enforcement. That's the point where, at least theoretically, there could be diversion, there could be tax avoidance, there could be youth sales, there could be break-ins, public safety risks. This is largely a cash industry. Every one of our regulations around that point of sale is aimed at reducing the risk of those kind of negative outcomes. And so when you move from kind of a fixed point retail location to kind of a diversified points of where the sale is actually going to be happening with a transfer, it gives us some pause, but I should say that it is a pilot. It's limited in the number of permit retail or delivery permits we can hand out. And there is a very broad grant of authority to the board to do this safely and effectively. And I can point you to that broad grant of authority in the bill if you'd like to see it. But I've been assured by Ledge Council that it essentially gives us the ability to kind of regulate every aspect like we would a retail sale. So
What are you thinking? So what is the implementation date for the delivery piece? Effective date for delivery?
The program becomes effective under the bill July 1st, and then it would be up to the CCBA to roll out the application process and forms necessary for the current program to exist. And additionally, the procedures would have to be adopted. The timeline for that is much shorter than administrative rules, but it still does require
The process at the board?
Right. So you're looking some point after July 1st.
And Senator Benson has a question, and I'll ask you a question.
And so it makes reference in here says that a plan that intoxicated person. So I'm curious, how do you know? To my knowledge, there's no way for testing like there is for alcohol or cannabis. So when we make reference to an intoxicated person in the rules, how does one determine that?
Every person who's authorized to make a sale, interact with a customer has to go through a training. It's mandated by the board. And, you know, there are, of course, breathalyzers on the alcohol side, but not in the cannabis side. But it's not like the bartender is breathalyzing you at the bar. It's really just visible cues that a person's intoxicated. And we have trainings to make sure that people aren't selling to intoxicated people currently. That's already that's under the existing statutes. We're prohibited, you know, bud tenders, as they're called, are prohibited from selling to intoxicated people. But it's more just visual signs.
Sides,
Right.
you know.
It's where it's speech. Okay.
The only other thing that I wanted to mention on delivery, because I know that when you write this authorization into statute or session law, and it says the board shall not grant more than 15 delivery permits annually. This is a 2-year pilot, so this would be 30 over the course of 2 years. We're going to have to roll this out slowly, and we may not issue all 30. I just want to be very clear with the committee of jurisdiction and this committee and anyone I talk to that we have to do this safely, and we have to make sure that we have the staff and the oversight over it. And so we may not get to 15. And I just wanted that to be, if
The economic development hear that same comment.
they heard the exact same comment, the finance committee heard it yesterday. I just want to be very clear on the record that we're not getting additional staff to implement this. And so I just don't want the expectation to be amongst the legislature that we're absolutely going to do 15 annually, because this also comes with an event permit as well. And we're also on a different bill taking over hemp processing regulation with no additional staff. So just want to make sure that that's clear, that we will do this safely. It's a discretionary grant to issue no more than 15. You know, we'll probably start trying to roll it out slowly and see how it works. If it's not a huge lift on the board, we'll roll out some more.
Thank you for that. But one of the things that this committee is going to be looking at overall in the next few weeks is prevention. And then we're going to pay attention a little bit to the excise tax fund, prevention fund that we have. And so your recommendations going forward will be really important, because it's access for minors that is of concern. And then high dosage is also a concern in here. So some of that has been dealt with in economic development, and you are reassuring me as you're speaking that this is going to be appropriately implemented. So in terms of the procedures that Parker was talking about, and so the bill goes into effect on July 1, then what are you looking at for a timeline on developing procedures?
So we won't be starting from scratch.
Yeah.
As I mentioned, every New England state has delivery, and in fact, Vermont has delivery, but in a very limited sense on the medical side.
Yes.
And it's a very different model than what's contemplated here. It's essentially, the retail store can deliver their own products to a verified address of a verified medical patient. So we're not going to be starting from scratch when it comes to developing procedures. We are going to need to, have public notice and comment on them to make sure that they're actually workable and that they address everyone's concerns, not just the industry's concerns. So, I mean, best case scenario, if this goes into effect July 1 and we know that it's been enacted, signed by the governor and all the rest, by July 1, we'll probably, as soon as it is signed or not, as soon as there's action on it, we'll start developing the procedures, hopefully have it ready by July 1st. When we
Thank you,
start
Tucker.
rolling out. So
We have a 40-page amendment that was sent to you for, we want it by.
Fantastic.
No, we don't have, we don't. Questions, for James Scott? Okay. Questions?
anything else on the bill, that you're concerned about? Again, I'm looking at it as the lens of can we implement these things, well, what it takes to implement, not whether or not we should do them.
Well, I think the Economic Development Committee has whittled down some of the big areas of concern for us. At some point, it would be helpful to have you come in and talk about the medical program,
Yep.
where it is and how it's going on, because it's not really in here.
No,
And so that would be helpful to us. And then, as I said before, looking at what are the prevention needs that we have in the community. And I know there are concerns by the retail folks regarding marketing. That's not our area until it starts to affect minors. So we're not going to deal with that right now. So we're just,
right,
that's,
yep, yeah, I'm happy to talk to you about the medical program whenever you want. I would just say at the outset, because of work that you did 2 years ago, medical patients are seeing unprecedented access for in the history of the program. And it's been rolled out safely. There's no, there has not been any issues with that. And, I think we've also effectively reduced the fee to become a medical patient by a third by extending the expiration date of the medical card. So there are some, and we're seeing the first uptake in the number of patients, registered patients since 2018. It's a modest uptake, but it's the first time that it hasn't been kind of falling off the cliff since.
good. Thank you for that. All right, that's good. We're gonna just take 3 minutes to talk about whether or not there's any suggestion for an amendment on this bill committee. Anybody have anything? Okay, we're good. And so, straw poll, I don't have a straw poll. We don't need anything. Our committee has evaluated the bill and we don't see a need for any changes in the bill at this point. And I can say that on the floor. And I'll also speak to Senator Boggart's proposal as well. We'll be good. And then tomorrow morning, we'll look at whatever we have on S-190, understanding, and I'd just like to say this, that both Boz and the board have legitimate positions. Our goal has always been alignment. What we do also, as we're aligning some of our reference-based pricing, we do not want to sacrifice the hospital. So their expectation of one level of savings is different from what they're seeing something else. So the goal here is to get some language that allows the board to go forward and us to know that there's alignment going on. So we'll just see what comes through. That's it. We're gonna wrap. We need time.